is passive joint movement. This is very, very important for opening blood flow into the joints, for getting passive movement into animals that don't have good joint movement. Maybe they have arthritis or other conditions that make it hard for them to move. The more you do this, the more movement they will get. But remember, you need to do it correctly. You have to make sure the dog's arms are stabilized. And what we are doing is just taking their joints through its normal range of motion. The first joint I'm going to show you with Josh is his wrist joint. And all we're going to do is we're going to flex the paw, and then we're going to extend it. Now right there I feel kind of a give, so I'm not going to bring it any farther than that. That's normal range of motion. Now, go a little farther than that, but that's not the normal range. So whatever's comfortable. And you always want to hold both sides of the joint you're working with. Now we're going to do flexion and extension of the elbow. Flexion of the elbow. And as you notice, I'm holding both sides of the elbow joint. I'm stabilizing it, and then we're going to extend it. If I don't stabilize this side, look what happens. I'm actually tugging on his shoulder, and I'm not moving the elbow joint. Flexion means bringing the angle of the bones together. Extension means to open them up. If you're really not so sure about what you're doing, just think of the normal movement of the dog's limbs and take it through that range of motion. This is very, very effective. It feels very, very good, and it brings that blood flow to the joint. Always remember to stabilize the arm or the leg, whatever we're working. If I don't, his limb will drop like that. And if I'm moving it, he is not in the normal alignment that we want. So stabilizing like that is very important. The shoulder is very easy. All we need to do is take the shoulder, which is right here, the top of the humerus or the arm, and we're just going to move it back. Again, that's flexion of the shoulder, and we're bringing it back this way. Extension, again, I'm stabilizing here, and I'm just pushing up on the back of the arm and bringing him forward. Now he's got a little tension there, so I'm not going to push anymore. But that feels very good. That opens up the whole shoulder joint. And the more that you do it, the better their range of motion is going to become. So if you have the time to incorporate a couple passes on each joint, that's all it takes. If you're doing that every day, it's going to help, particularly the geriatric dog, get more blood flowing and get them so that they can move some more. If there's blood in those areas, the connective tissue and the muscles surround it will relax easier, and they'll be able to move more, and the more that they move, the more blood is going to get in the tissue. That's why exercise is so important. So, like all the others, the same goes for the back. You want to do the same with the hock or the ankle. And as you can see, you can do this in a matter of a couple minutes. Then I'm going to take the stifle or the knee joint, bring it into extension, flexion, extension. Then again, I'm going to stabilize the leg and just bring the hip up into flexion, just by pushing on the hamstring muscles or the back of the leg. And then I'm going to bring the leg into extension. If you only have a couple minutes a day, get your dog relaxed, try to do passive joint movement. It's very, very effective, and you will be really surprised at the results that can be attained by doing this. So that's passive joint movement, and after you've done that, you will notice that the musculature is a little bit more lax, and you can get in there and work it a little bit more.